lesson.
Thank you, Jaylee. Okay, which I just did. So thank you, thank you. All right. Okay, so the first thing we're going to do starting this week that I promised you we would do is we're going to do attendance. And I will do random 10 attendance for 50 points, and then the other points will come from reviewing your class participation logs. There we go. All right, so just tell me if you're here. Jolie Allen.
Here.
Skyla Bates. Amy Blackwell.
Here.
Davin Brooks.
Here.
Charlisha Brown.
I'm here.
Morgan.
I'm here.
Morgan Calhoun. Tanisha Cato. Fonda Carlson.
I'm here.
I appreciate this. It goes a little faster. Kinsey. How do you say your last name? I'm sorry.
Farquhar.
Farquhar.
Farquhar, yes, ma'am. I'm here.
Farquhar. Okay. Franklin. Alexis.
Here.
Hannah Gray. Saw you.
Here.
Bree Greer. Jay Lee is here. Reagan Jones.
Here.
Was Desiree Greer here? Timothy Kelly. Angel Kinney.
Here.
Lexia Lenore.
Here.
Caitlin Morris.
Here.
Cassie Parpart.
Here.
Is that the correct way to say that?
Yes, that's part.
Parpart. Okay. Aaron Richterberg.
Here.
Miles, I saw you. Didn't I?
Yes, ma'am.
I did see you. Nikayla Thompson. Treadway. Kiana Treadway. Mariah Washington. Jasmine Williams, I saw you, yeah. Okay, all right, good. Okay, so I will randomly do that, and then the other points for attendance or class participation rather will be from your Moodle logs, as I had said last time. So let's go ahead and get started for today. I do want to try to have a short class because I got to finish up my winter session grades and get them submitted before 3 o'clock. But I want to go over at least these notes that we had. We just kind of did it, just general discussion last week because it was our first week of class, and hopefully everybody's gotten added. So we have a completed roster now, and we did the introduction. Yes. Okay. All right. So we started out with this infographic here about life expectancy, and that persons who take the adverse childhood experiences who have from 5 on up tend to have greater risk of physical problems as well as emotional and psychological problems too. So your lifespan can be reduced depending on, oh wait, I'm sorry, I said 5. It's 6 or more ACEs died nearly 20 years earlier on average, okay? So that's a pretty big deal. And also, not to mention the cost of persons who experience adverse childhood experiences, ACEs, in terms of how much an individual can produce toward their own personal resources, and it include their income. Healthcare costs go up, special education needs are increased, and child welfare, as well as our criminal justice system. In fact, our criminal justice system, according to Kathy Whittam, who studied and is still studying, to my knowledge. I know she's published as recently as the late 2000s. She was responsible for the information we ran with in our literature in child welfare, particularly child maltreatment. It's actually a journal of child maltreatment. And she studied criminals of violent crime. And she found that the majority of them, I can't cite the actual statistic right now, but the majority of them had a history of foster care and child maltreatment. That was in the 90s. When she reprised her study, she also refined her study. Reprised means she did it again, and she refined it and discovered that indeed, as we were seeing in child welfare research among primarily social workers, but also psychologists and others who study child welfare issues like child abuse and neglect and so on. She found that it wasn't just that violent criminals had histories of foster care and specifically histories of severe maltreatment of some kind, severe neglect, severe sexual abuse, severe physical abuse or abandonment, that those individuals didn't just have foster care, they had lots of foster care. So the implication is that, which requires further study, of course, but the implication is that attachment is a pretty big deal. And so when we have a healthy attachment to a caregiver that can do not the premium or very best form of child care in parenting, but that do adequately in parenting, adequately, not the very best, and don't treat them 100%. You know, don't get guilt complexes if you yell at them one time because you're frustrated and you got bills due or something. That happens to all of us as parents. Everyone who has a child is going to experience those moments. It doesn't make you a bad parent. If you systematically maltreat your children, as in my winter session course, I was reading the articles that they posted as an assignment for a forum assignment. You see these reports in the media about children, the most horrific form of child maltreatment. And out of, I think, 10 students in that class this winter that's finishing up grades going in today, that out of 10 students who posted links, half of them had the name of the case, where it was from, and most horrific case ever, or something similar to that. And when I saw them, I thought they're repeating these, but no, they were not. In fact, two separate cases in the same year from Blount County. This was not COVID time, this was 2019, Alabama, which is sort of between Birmingham and Anniston, Alabama, which is about, Anniston, Alabama is about 100 miles from Atlanta. So it's right in that area. And it's more northern Alabama. A lot of meth labs up there when I worked there for 10 years. And so, you know, who knows if that's what is associated with those kinds of cases. I don't know. But in any case, the criminal justice system finds that of those cases that are the most horrific, that cause a child to have their attachment with their caregiver impaired or completely broken, then they may end up with multiple foster home placements. There is an association, it seems, in as much as we can tell, not a strong correlation in research I've seen so far, but in research so far, like in the most recent from 2015 to 2020 of published literature I've seen, and I've not done extensive searches, but of that I've seen in those years, those 5 years, it seems that the correlation is getting stronger, meaning that multiple moves that Kathy Whittam found, who is a criminal justice researcher, is contributory to serious enough dysfunction to land people in jail. So the costs are going up. And then there are other issues associated with that we'll talk about later with child neglect, okay? So I pointed out when I was on the road talking to y'all last time that these Zoom class meetings, this will disappear because it didn't, I couldn't connect in the classroom. And I just pray everybody got the message. I sent it by email and put it on announcements, which are often delayed in your receiving them. I went up to the classroom and the monitor was not hooked up, and I could not for the life of me figure out if it was the monitor or the internet. I don't know, but it would not connect. So I spent 10 minutes doing it up there and found no one. So this will switch to attendance for today, and we will have the recording available for everyone. Okay. I will attempt again to do the classroom meeting in the classroom there on Thursday because it wasn't connecting today. Typically though, we will only be on Zoom. Okay. All right. So let's review this. Reading assignments from chapters 2 and 3 that are attached, a video assignment about complex trauma and the impact on childhood development, which I'm basically referring to. You had a topical assignment. This counted for credit. Your reflective writing, which is just an opportunity for you to react to the material. And it doesn't mean I'm expecting you to, tell me deep, dark secrets. If you are so moved, okay, that's a safe place. It goes nowhere beyond me and you writing, and then it disappears when the class closes. But generally, it's for you to respond to the course material in regard to, what you're getting out of it or what you think about it or whatever. But just write. This is the one thing that is easy to do and to get full points for. Just got to do it on time, okay? And a supplemental resource, the American Society for the Positive Care of Children. And here it just discusses what this is here for. And it is to give you a little history about how we came to be in this current state of reacting to children who are maltreated. And I'll come back to that. I'm just going to point through all of these just to point them out. Supplemental, the National Prevent Child Abuse America. Every state used to have a chapter. I was very active in the one here in Louisiana until it was disbanded because there just wasn't enough staff, and mainly there wasn't enough funding for it to keep going. And supplemental means supplemental, that you are not required to look at these, but they're there to enhance the material for you to dig deeper if you choose, okay? And then the Alliance for Strong Families and Communities. This is what we would refer to as a preventive organization and website. And the Faces of Child Abuse, which basically shows you, let's just look at it and we'll go backwards from here, okay? It is a site that demonstrates some of the pictures, some of the same ones that you saw online. I'm confused with the winter session. I'm so sorry. Just had a pop-up. Okay. You will see these online. So these faces of child maltreatment, these are images of the outcome of child maltreatment, the physical manifestations. And I'll just hit these briefly. You're going to have an hour-long video that you're going to look at. Let me just give you some brief stuff about this. This is what's called a stocking burn. And it is because it looks like a stocking. You see that? Can y'all see my arrow? No, you can't because I didn't share my screen. Okay, now you can see my arrow, right? Where I'm pointing. You see I'm pointing on the face of the little girl. Okay, good. All right. Okay, so these are just pictures that are introducing you to the content of the material. Now, I do like to put this out front. If some of you, and I know a few of you in this class did take family with me, and I just put the hard stuff up front. And the reason is because it is intended to shock you. If you can't tolerate the shock in this class And if you're intending to work in any capacity where you're going to see child maltreatment, any healthcare profession, teaching, but especially social work, and most especially if you're going to work in child maltreatment, you can't do that job effectively for children who are suffering if you can't recognize without shock and judgment with things that you may see. I have a gentleman who is a teacher in special ed out of Utah that was taking my winter session class and was, going for additional courses for certification there. And, said exactly that. It's something I've been saying my entire career of teaching child maltreatment since the 90s. And he said exactly the same thing. He, a young man teaching with his own family and, saying the same thing, that in his short career, he has seen things in the classroom that have been pretty bad. Perhaps not as commonly as, say, a child protective social worker, a social worker who works with the Public Child Welfare Agency, whose duty it is to investigate reports of abuse. You never know what you're going to find in those positions. So yeah, I throw it out there to you. We're going to cover it in more detail. You'll see some of this again, but for now, let me just point out a few of the general things. It gets more detailed as we go along in the course, but these are general aspects of these particular injuries that we would show you, okay? So one indicator of physical abuse, for example, is the type of burn and the degree of the burn. If you look right here, if you can see my arrow, I have it enlarged on my desktop, but if you can see this arrow, you see the arrow on the black spot that I'm showing you?
Yes, ma'am.
Okay, well, follow that arrow carefully. I'm dragging it over to where the handprint is right here. Or not the handprint, but the hand who's gently holding the heel of this baby. And you see that edge of that skin right there? That means that is a 3rd degree burn right there. It's gone down past the top layer of your skin. I don't dare say the wrong word because I'll say the wrong. In any case, this is called, like I said, a stocking burn because it looks like the child was either kneeling or it could possibly be where water was thrown on the child, so that you have this kind of random pattern here. A true stocking burn, though, will have the entire limb that's submerged in hot water. Over here, you have an indicator that we call the pattern of the instrument used. And here it is, an iron. You see that? On this, it looks like this child's leg where he has his knee bent, because this is his knee right here. You see that? And then you see these little specks right here. That's the iron. Imagine someone doing that to you at your age right now in this class, saying, you know what? I don't like what you did. And they hit you like that. Imagine that. Much less imagine if you were, well, I don't know, 2 years old. By the way that the infant soiled himself, potty training is one of the worst times for children to show up with injuries. Here, you've got another child, in this case, a baby. I don't know, looks to be 6 to 8 months, maybe that, I'm not quite sure, quite that old even. And these are, stocking or glove burns. Looks like the whole hand was submerged in scalding water. Here is, these are indicators of bruising. And we're going to look at stages of bruising, okay? Stages of bruising are indicative of how long or how often the physical abuse of hitting occurs. And here it shows that this is the handprint of an adult who hit this child so hard that they probably shook her head, it looks like, because that has to be pretty hard with an adult hand to leave a bruise like that. Bruises fade when you're first hit hard, it just looks like red spots, right? And then the red spots turn into bruising, and the bruising is very dark, like right here. And then it begins to fade. So the contact area of her hand or his hand, whoever hit this child, there was less pressure here, looks like a little finger maybe, and more here with the center digits. And that's usually what hits first when you get hit like that. And here, these are tie burns and bruises, where in this case, it describes a baby tied to his crib. These are pretty stock images that are used in lectures of child maltreatment, but they're real, very real. I've seen the very same ones from a physician who's now, I believe since retired, used to work for the Department of Child and Family Services back in the day, and was the designated physician for physical investigation of child maltreatment. Her name was Dr. Mead Boyle, is still Mead Boyle. And she used to come with her own personal slides that you'll hear some stories from. Regrettably, they're her slides and not available to the public, but same types of injuries, same thing. It doesn't matter what physician, whose slides you look at, same manifestations. Here is a severe burn that they're demonstrating, but we have to be careful about this. To me, this looks like something that's culturally called coining, C-O-I-N-I-N-G, where some Asian cultures will, Vietnamese notably is one such, but there are other Asian cultures who will heat up metal coins, metallic coins. And they may be, I don't know, something from Chuck E. Cheese game coins, or, a quarter or whatever, kind of coinage they may have. And they will use that and stroke, they'll heat it up, and then they'll stroke the back like that, down, up and down, sideways. And it is a healing technique. So whereas these look really bad, they're not burned like this, nor this, nor this. You see that? So we have to be careful about those. This organization is, I don't want to describe it as sketchy, but it's a little exploitive. That's a better term. But because it has this as an introduction is why I use it. Here's a child severely beaten. You see that there's injuries around the mouth. You see the black eye, the bloody nose. So this isn't a child that's just smacked. This is a child that's literally beat in the face. This one could be beat in the face, or it could be that there was a terrific fall. But the problem is that a fall would not normally involve this degree of injury. But nonetheless, that's why we look at the history. You're going to learn that there are 5 different areas that we assess for child physical abuse and, well, really any form of maltreatment. And basically those are the child's physical appearance, the child's behavior interaction with the parent's behavior. Oh, Lord, just lost the 5th one. Let's see, physical, and the history of the incident. So we've got the child's behavior, the child's physical injuries, the parent-child interaction, the parent's behavior, and the history of the child maltreatment. Because there are different things that show up that indicate potential child maltreatment when you see, especially physical abuse that looks non-accidental. Sometimes, however, it is difficult to tell non-accidental or cultural, like here, situations, right? Here, you've got another picture of a poor baby with scalding, but you also see up here mouth injuries. This looks like a bottle feeding injury. What happens here, and possibly could happen here, in addition to being just beat up in the face, is force feeding. So for example, a parent may be very frustrated in trying to get a child fed and the child won't eat, or the child is taking too long, wants to, just suckle and nurture. And so you're feeding them, and if it's bottle feeding that causes that kind of what looks like an injury here, it's hard to blow these up from this website, but it looks like force feeding by the rim of a bottle that is literally punched in the child's mouth. I'm glad y'all can't see. I don't know. Can you see me? That's punched in the child's mouth. Okay. And this is a good example of patterns of bruising. So this is one that's a common film or picture that's used. So is this one. But it shows like very light. I can see it. Perhaps you can, I don't know, but there are various spots that look lighter than some of these darker spots. The darker the bruise, the newer it is. The more bruises there are of different colors, almost faded out, slightly yellow to, sort of maybe a little darkish yellowish blue to dark blue. That's blood under the surface. Those are telltale signs that this child is not only beaten to create these newer injuries, but is routinely beaten. And not just on the buttocks area, they're beat all around their body. This is very dangerous because you see this injury up here, that's an older injury. And there's some very light bruises right up here. This area of the body is where some of your vital organs are, notably your liver, your spleen, your lower intestine. What happens here is you can rupture those. So parents who think that they're beating their child and they, maybe the child twists or something the older they get, that is incredibly dangerous and can cause internal bleeding. When they bleed internally, they can go into shock and die. I actually had a case in the emergency room that I worked on some years ago with a detective that involved a scene just like that, as well as other types of scabbing that actually convicted the mother, or well, not the mother, but the father's mother, the father's girlfriend who had been abusing the child. And here's one that's severely beaten. You would expect to see maybe an injury around the orbital rim of a child. That's not abnormal at all. My grandson his mother's a pediatrician. Of course, that doesn't mean she's immune. Okay, she has frustration. She's human too. She could do it too. But what we see generally is on the hard bone, your orbital rim. Can y'all see me making hand movements over here on this other screen, or can you just see the?
Yes.
Yes, ma'am.
Oh, okay. All right. Sometimes I get a little too graphic, I guess. I don't know. But I'm going to show you this. This part, if you feel this part of your head, you can feel that orbital rim. Normal childhood injuries, especially in toddlers. I mean, toddlers get all kind of bruises and little scabs and stuff, but they normally get them on the surfaces where the bone is closest to the skin. So they get injuries on their knees, on their shins, on their elbows, on their cheekbones, because you can feel that too, right? And you can feel this orbital rim, their forehead, but they don't get them on soft tissue. So here, this is a child that's really been beaten bad. And then here we go right here is where we're starting to get bleeding, not only here, that can cause blindness. And it is also involving what we call soft tissue. So if you feel like right under your eye, right in there, there's that bone, but then you start feeling the soft tissue around it, the fat in your face, right? So when that starts getting involved, then that's when you got to explore those other areas of assessment. Here's a child beaten on the face. It says child neglect, so who knows? Here's a child severely beaten. Here's one beaten, and this looks exactly like what you would expect to see with forced feeding. His mouth swollen, he's got injuries here. He's got this around his mouth. Now, when you see that many teeth, how old's the child you guessing right there? That's your cue. Best guess.
10 months.
10 months?
I'm not really sure when they start like growing teeth.
Right. But what about the teeth?
Are they just coming in?
Well, they could have a few, but they're not going to have a whole mouthful. You see these bigger teeth? This
I'd
looks,
say toddler age, probably.
yes.
I'd say more like 2.
Yeah.
Yeah.
Well, definitely not just infant anymore, right? So we would say a little bit older, and the reason is because we have these teeth. And you don't see any missing. So usually you start losing teeth around, by the time you maybe when you get in kindergarten, but for sure when you get in first grade, a little bit before then even, right? So toddler is probably right, somewhere between 2 to 4. He could still, or she could still be using a bottle, or the mother could just be, making them use that. It could be neglect, who knows? But you've got lots of scabbing, here and this. Again, soft tissue, facial beading, eyes beading. This is called raccoon eyes. And raccoon eyes is what happens when you have bleeding up under the surface that, like I said, as in this picture up here, severe enough that when it continues to occur, it can actually cause blindness. And it can also cause a brain bleed, because when they're beaten that hard, it could be that. And also look here, you see some evidence of what I told you a minute ago about bruising that contributes to recognizing ongoing pattern of abuse. Tragic pictures here. Here's one of scars that are left, okay? And just terrible things that they're showing you here, all these pictures. This is an infant, brand new infant. Umbilical cord hasn't even gone in. These are real things. This is a postmortem right here. This reminds me a lot of the child that I saw in the emergency room that was 3 years old. He didn't have all of these kinds of injuries or burns or anything like that, but he had bruises down his back, down his vertebra there. And you'll hear more about that story later, because it involved family dynamics that we'll talk about that contribute to child maltreatment. He died of brain bleed because he was dragged down steps by the father's girlfriend who was watching him. And we were able to tell the bruising down his back. And more injuries of being beaten. Again, another postmortem. This looks like an NICU child. Here is this is a very common picture shown in books, used in books, another stock, but real, okay? Here is a whole chest injury here with lacerations. This is a laceration that we commonly see with cords or belts, because what happens is when you, let me see if I got a cord, I'll show you. Right at my desk here. So see, we take this and we're gonna get real mad and we're gonna loop it like this, right? And then we're gonna hit. And what happens is these parts of the loop tear the skin, depending on, and the tear is dependent on the amount of force that's used to hit that child. So that's what causes those, and that's a double loop. And most common parents grab electrical cords, I don't know why. And then this last one they're showing here, this is actually a picture of a bite mark that's also pretty stock in presentations of child maltreatment and recognition of child maltreatment. It's common for children to be bitten by other children, especially toddlers. They're still very orally focused, that oral gratification that Freud told us about actually is still a thing, kind of, but we don't use that terminology to describe human development anymore, though, necessarily. But however, there's still a lot of involvement with feeding issues. So you have children that assert they fight with each other or get, aggravated or whatever between, 2 and 3, and they may bite each other. But you don't see adult bites, right? And depending on, this may shock you too, or make you sick, one or both. It depends on where these are that can suggest either or both physical abuse or sexual abuse. Now, if it's sexual abuse, bites on the back of a child, bites around the genitalia, bites on the butt, are sexual abuse implications. Adult bites of any kind are suspect for maltreatment. But I can tell you from my own experience, Dr. Salisbury did this class with me and can attest that we had a parent who had her, I don't know, he was, wasn't quite a toddler. He might've been like 10 to 15, 16 months old. I don't know, something like that. But he was big enough that he could pull up and stand on her lap. And we would have the parents and their children, because it was an early childhood parenting class, we would have them bring their children and we would observe and be able to give feedback on their interactions to the parenting information we were providing and their interactions with their child. Well, this was one such case that we're talking about, how to control our anger and manage behavior, etc. And lo and behold, we're in this group and this mama has her child, this baby, an older baby to be sure, who pulls up on her and she's getting obviously aggravated, right? She's trying to make him sit in her lap still, which isn't going to happen with a kid that age, right? So we're trying to sort of gently talk through that. Dr. Salisbury and I co-led lots of parenting groups of different age ranges and so on. And this mama reaches right up on that kid's shoulder and just bites the slop out of him. Oh my gosh. And we just both sat there just shocked. We didn't know quite how to react, because that was the first time I'd experienced it and the first time Dr. Salisbury, to my knowledge, had ever experienced it as well. And, so we had to meet with her afterwards and inform her that, that we were going to talk about that appropriate means of disciplining your child, that biting is not one of them and can get you further involved with Child Protective Services. So we want to learn that's not what we said. We want to learn how to, we want to teach you other ways to discipline your child than that most immediate source of inflicting pain. You see, she couldn't slap him or smack him, so she, just bit him. And then just another picture of bruising injuries on looks like a child's leg. So there you go, the most shocking pictures. You will be revisiting these in a hour-long presentation by Department of Child and Family Services out of Florida's Child Welfare Agency that's conducted and done by a doctor, a physician, and you'll have notes from that as well later, okay? Any questions about any of that? Okay.
I have a question.
Go ahead.
Are there any due dates on Moodle? Because I didn't see any.
No, you don't have anything up there yet for a due date.
Okay, thank you.
No. Well, I take that back. You have this topical assignment in your reflective writing that was due for Unit 1.
Yes, ma'am. And the due dates are on, like when you click on the assignment, it's on the assignment, but if you go to like the calendar, the due dates, like the assignments are on the calendar. So like, is there any way you can put it on the
Oh, I know what
calendar?
you're talking about. We had discussion about this in faculty meeting about adding the calendar. Okay. Yeah, I'll do that. I'll
I'm sorry, was the reflective writing due yesterday too?
Yes. Mm-hmm.
Okay.
Yeah. I always try to put the required stuff up front. Okay. So everything that you are required to look at or your assignments are always going to be in the top first items. Okay. So you had a video assignment to review this complex trauma impact on childhood development. We're going to talk about that. But we're probably going to carry that over to Tuesday because I need to, next Tuesday, because I need to finish up some grading for winter session. Who and what constitutes American response to child abuse and neglect? Here's your topical assignment, ACEs. You take the ACE and write about it. And then your reflective writing that I mentioned when we started out today. Okay. And then we just took attendance. So we're going to move that up here. Okay. All right. So let's just touch on these things right here. My husband was telling me this morning while I'm pulling this up. This is just simply another presentation of the ACEs, and it shows you, you know, how many, what your responses, response options are. Oh, this is, I'm sorry, this is for coding. This is for research purposes. That's just showing you those and how we use them for research purposes.
Also, Dr. Savage,
Mm-hmm.
there wasn't a due date on the reflective writing.
Yeah, it wasn't.
Oh, okay.
It
Well,
just says this must be made at the end of each of the 4 weeks in this winter session.
Yeah, because
Oh.
I sent an email because I wasn't sure if it was due now or later.
Okay, well, I'll be putting the due dates for each unit up there, but you do have the entire unit period to get it done. In other words, I'm not going to charge you. I'm not going to take points away if you don't, you know, get it done. Like if you didn't get it done by Sunday, for example. Does that
Okay, so it says Unit 1, Monday, January 11th to Sunday, February 7th. So just make sure we have it done by February 7th.
exactly?
All right, okay.
Thank you.
Everybody else got it? Okay. All right.
Yes,
So
ma'am.
okay, good. So let's just look at this. What she's talking about here, this gets into one of those aspects of assessment, the 5 aspects of assessment I was talking about, the family. Let's see, I said environment. That's environment. That's at number 5. Okay. The 5 areas of assessing child maltreatment in any of its forms is the child's physical condition, whether they have bruises, whether they don't, whatever. Whether they've tried to commit suicide, we're going to talk about that associated with emotional maltreatment. The child's behavior, are they withdrawn? Are they overly social, too easily adapting to strangers, for example? They could go either extreme. The parent's behavior, the parent-child interaction, and I said, what did I say the first time? Because it's environment is what I should have said. What did I say? Anybody remember? I think I said the history. Well, the history comes from all of these different aspects that you're going to get, because the parent's behavior, if they're irritable and, you know, just complain about the child and they give you a story that doesn't fit what you're seeing, then that all fits under the child's parent or caregiver who is responsible for the maltreatment that you may see. The 5th one is the environment. Is the environment chaotic? Is it extreme? I once visited did a home visit for a foster child, and we were trying to keep the placement intact. And this woman had 5, she was in Monroe, she had 5 kids, and they were the most well-behaved kids I've ever seen in my life. I mean, she called them out, they sat down in a perfect line, various ages, and did not speak a word. And then she dismissed them like, go. This lady had, I don't know, I don't even know how to do it. It was stunning walking in her house because she had ornamental things. I promise you, there must have been there must have been every inch of her kitchen walls were covered with butterfly things, stickers, magnets on the refrigerator. I mean, everywhere. But the house was clean as it could be. It was just all of this stuff displayed everywhere. And same thing in the living room. I think it was birds in there. There was something on the wall and lots of looked like green plants of some sort, artificial plants. This lady had a history of schizophrenia. And so we were looking at, you know, is this placement really healthy for these kids or what? And I can tell you, going into that environment, as clean and spotless as it was, the outward appearance was kind of strange. And that doesn't mean that, you know, people don't hoard and do stuff like that. Sure they do, but that's another kind of mental illness too, you know? So, yeah, we ended up moving all those kids. Probably better off for them too. So anyway, so family and the family roles and responsibilities of the child. When we look at the family as a system, we look at the interactions between the parents and the children when we're studying child maltreatment, because we want to know what's going on within that family in regards to how the individual members are interacting with one another. And if all of those different assessment areas that I'm talking about are impacting any one individual's well-being, any parent, any child within that family system, or grandparent who might be there, aunt or uncle, foster parent, whomever. Boundaries are important when we're understanding child maltreatment, especially when we come to sexual abuse, but really all forms now in more current literature on child maltreatment. I'm glad to say that we're moving more towards talking about child maltreatment at large, rather than just child abuse or child neglect or child sexual abuse, because it's all interconnected to some degree or another. Not that one child is going to experience every form of maltreatment. That's not what I mean by interconnected, but they're interconnected with family relationships dependent on the type of maltreatment that occurs. The way that we interact with others, the roles that we take on, family roles can have a big deal with child maltreatment. Parents who expect their kids to take on adult caregiving roles for them as parents rather than the other way around, the parents being the parents, is very dysfunctional. That's an understatement, if ever there was one, and can, you know, cause burdens on children and confusion. The way they interact with their communication patterns, the attachment that occurs if it's a child who is not able to form a healthy initial bond with the parent, that can occur in adoption placements as well as biological placements. We used to talk about maternal infant bonding as so crucial, but yet thought that if we didn't have strong maternal infant bonding at the point of birth, that there would be problems for the child later on. We know that that's not true, because adoptive children and parents, their adoptive parents and children who they adopt, can have healthy attachments too. Dr. O'Boyle, that I spoke of before, was an adoptive parent, did not have any biologicals of her own, and would attest to the fact that indeed she formed an attachment with every one of hers. And it was pretty obvious too in the lots of interaction that I had with her as our kids were growing up. So the infant child attachment, or the child parent attachment, occurs as a kind of dance, just like when you find a romantic partner or a good friend. You have a kind of dance that occurs between you, where you get to know each other and you become comfortable with each other, and you begin to feel sense of support from one another, and indeed love. What do we call it? Platonic love with friends, close friends, versus romantic love with a partner, a sexual romantic partner. So those kinds of relationships start out with that kind of bonding process. And from there, over time, that bond, depending on the nature of it, determines the quality of that long-term relationship that we call attachment, especially with parents and children. Things that are done in the family routinely, like regular dinners, rather than hit or miss dinners, where a parent may say, well, we're not going to eat dinner tonight, so grab something out of the refrigerator, whatever. Now, I'm not saying that that is inherently bad. I have done that myself when my kids were older, okay? But a younger child that can barely get to the refrigerator, not so cool. So that's not a healthy ritual to tell children to feed themselves, basically. But to be involved with the ritual, whether it's dinner or bedtime or homework or regularly reading books or whatever you do that is something special that you do or a person does as a parent with their child, is what we call rituals. And they cause predictability in an environment for a child. That's very important. So that's what all of those are related to that she's talking about. We need to be aware, and I'm going to let you read these because I really do. I just saw another pop-up, so I got to get my grades done. There are different aspects according to Croissant Tower. I can elaborate a whole semester on these issues and have actually about cultural differences in parenting. Dr. Salisbury is a certified trainer in a parent program called Black Effectiveness Parenting. And there are very unique aspects to different cultural groups. So we need to be aware of that. Sorry, I skipped back. So you read these, see if you agree or disagree. I need to make that assignment one day. Same with Hispanic. She's giving you some background here, the author here. And it's important for you to read these and look at these. Perhaps we can have some talk about these on Thursday. And then finally, she ends this chapter that we're interested in with what kinds of family problems occur that can cause dysfunctions in the parent-child relationship or the caregiver-child relationship. Sometimes they're foster parents, sometimes they're adoptive parents, sometimes they're grandparents who are raising children. It's not always the biological or adopted parents. So it can be any child caregiver raising children in a family environment. But it can also be child caregivers who spend significant blocks of time like daycare or school, okay, or recreational activities. So be aware of that. Dysfunctions that can occur. This one, first one, failure to provide basic needs. Notice that it includes nurturance. Some authors add, and I like this addition, will add to what Croissant Tower, the author of this material, they add spirituality. And this doesn't mean going to church. I think I talked some about that before, just touched on it. But it means imbuing the child with a sense of shared moral basis for living in a social environment. So, and for most of us, spirituality does associate with some sort of higher power, something bigger than ourselves, whatever you want to call it. Crises, I skipped this one. Dealing with developmental tasks. That parent that I told you about that bit her kid as a form of discipline right in front of us, that's not responding to the developmental task of that child. What would have been a better response to the developmental task was to not expect her child, a toddler, to sit still for an entire hour, but to take us up our invitation to stand up and walk around with your child just so long as you're still in earshot. Or to, if it gets really disruptive, take your child outside of the room and one of us will go with you. And that's an example in that earlier case I gave you of not responding to developmental tasks. Social pressures, prejudice certainly can cause dysfunctions in a family. This is something that is very interesting when we talk about cross-cultural adoptions, more on that later. And then factors that contribute to child maltreatment. The belief that the family has sole right to raise their children as they see fit, and that state has no role in intervening. And that can actually contribute to parents covering up or trying to hide circumstances of dysfunction that can lead to child maltreatment. Okay, I'm going to leave off there. I want you to go through these. We'll pick that up on Thursday, and hopefully, well, I don't know. I'll send you an announcement with an email copy about other stuff, hopefully even clarifying some of your questions, okay? So that's it for today. One goes through the first 4 weeks. Okay, going once, twice, 3 times. Okay, I like this one. I use it in class. Done. I'll see y'all Thursday.
Dr. Savage,
Yes.
are we having our 9 o'clock class tomorrow?
Yes.
Okay.
Yes.
All right, we'll see you then.
Okie doke. Great. Wonderful.
Dr. Savage,
Yes.
I just want to let you know that I work in West Monroe and get off at noon, so I'm going to try my best to be on time when we go in
Okay.
class, but
Okay.
there might be days that I'm a couple minutes late just because I have to drive back to campus and then walk to class because I can't park on campus because I live on campus.
Oh boy. Okay.
Yeah.
All right.
I will do my best.
Okay. All right. Yeah. And just let me know when you get on so that I'm sure to record your attendance if you're too late, because I'm going to require, I won't take attendance after say 1 o'clock.
Yes, ma'am.
Okay. All right. Good. Thanks for letting me know.
No problem.
Anybody else?